shows you what you're looking at. All right.
I didn't do it.
You can stand next to her. I was watching her over there.
All right.
I'm gonna stand right here.
Starting with the respiratory system, if you see a pipette and you see it on both ends, you're in the nasal, the oropharynx. Okay. If you see a pipette and you see both ends, you're in the oropharynx. If you see a pipette, medial and middle, same. Medial and middle are the same.
Same thing.
If you see the pipette in and you're not seeing anything in the mouth, then it's in the nasal pharynx.
Okay.
Okay? Then doing respiratory, you have the nostrils, you have the nasopharynx, you have the larynx, you have the trachea, and you have the right and left primary bronchi. So you have the trachea, the larynx, and the right and left primary bronchi. You have the superior, middle, and inferior lobe. You have the mediastinal lobe. You have the superior, middle, inferior. And you have the diaphragm. So that's your respiratory. Then the nostril, the nasal cavity, the nasopharynx, the larynx, the trachea, right and left primary bronchi, lungs, and diaphragm. Okay? Then the oral cavity, you have the rugae, which are the ridges, the teeth, which are the incisors and canines, are the main teeth. You have the tongue with the papillae, and the papillae have taste buds, but they also, in the cat, they clean their fur with them. So your tongue is used for chewing and for moving the food around, for tasting the food, but in the cat it's also used for cleansing. Then you have the nasal cavity, you have the hard and the soft palate. So if I had the pipette there, and you see it on both ends, the soft palate is underneath the pipette. If I had the pipette in the nasal cavity, then the soft and hard palate are over the pipette, because the soft and hard palate divide the nasal cavity and the oral cavity. So if you see both ends, you're in the oral cavity. Then oral cavity wise, you have the mouth, the esophagus, you have the esophageal sphincter, which goes into the stomach. The stomach, you have the cardiac sphincter or esophageal sphincter. Then you have the fundus, the body, and the pylorus. You have the pyloric sphincter, which goes from the stomach into the small intestine. You have rugae in the stomach. See, these folds are rugae, which are for expansion. You have grass. and right here, where it changes texture, that's the pyloric sphincter right there, that little ridge. And then once you go into the duodenum, that's all villi. See all those little velvety? That tissue tells you you've gone from stomach, which is smooth, to villi in the small intestine.
What is it?
Then that's villi in the small intestine.
This pyloric.
This is the pyloric sphincter there. And then you go into duodenum of the small intestine. The duodenum has the pancreas in its fold, and the pancreas goes all the way from the duodenum over to the spleen in general. But this guy is really, this is a really small cat.
Spleen?
This is the spleen right here.
Oh,
Okay.
I mean pancreas.
The pancreas is right in the curve of the duodenum, and it usually goes all the way over to your spleen. But this cat is so, oh, here's some here. Here's some pancreas there. That's pancreas, and this is pancreas. Okay? So this is all small intestine. The first 12 inches of our intestines are duodenum. Where it makes that tight kink, that's jejunum. So duodenum, jejunum, and then where you find the cecum, then you have the ileocecal sphincter, and that's this one. This nice ridge here is the ileocecal sphincter. So you have duodenum, you have jejunum, and you have ileum. So the ileum meets the large intestine at the cecum, and you have the ileocecal sphincter. Then you have the ascending colon, transverse colon, descending colon. and then rectum and anus. Okay.
And that's the large intestine.
Oh, I'm sorry?
That's the large intestine. Then.
Yeah, this is all large intestine. See how much wider it is than this?
Yeah.
So this is small, this is large. You have cecum, ascending colon, transverse colon, descending colon, and we would also have the sigmoid colon.
Okay.
And urinary tract wise, you have 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. But that's not for this test. It's just so you won't have to open them up again until later on. Liver wise, you have right under the diaphragm, you have the right medial lobe with the gallbladder. That's the gallbladder. And the left medial lobe. That's our liver, right and left. Okay? Then under here, you would also have a caudate lobe, and we have a quadrate lobe. They have a caudate lobe. They don't have a quadrate lobe. So right and left medial lobes. The right medial lobe has the gallbladder, and the left medial lobe. And they have right lateral and left lateral and caudate.
And where's the?
But these are the 2 you need to know for the test. Right medial with the gallbladder and left medial, because this is like ours. Okay.
And where's the gallbladder?
The green thing, that's the gallbladder.
Oh, okay.
And that's where bile is stored.
Okay.
Okay. Diaphragm, this is the diaphragm. And that separates the thoracic cavity from the abdominal cavity. Okay. That's really what you need to
The
know.
gallbladder is located on the right side?
Right medial lobe.
Okay.
Of the liver. These are lungs, that's liver. What else?
Did you go over the vocal cords?
Okay. Yep. This is the trachea with the C rings. Okay, that's where you would have the hyaline cartilage, and then if you go through the larynx, you'll see the tracheal membrane is that soft tissue there, and right behind it is the esophagus, and the esophagus also has rugae in it. Those are the ridges. But when you look at the larynx, you have the hyoid bone, which is on top, and then you have the thyroid cartilage and the cricoid cartilage. And in back, you have the little arytenoid cartilages, which anchor the vocal cords. These are the arytenoid cartilages, and these are the vocal cords. And then this is the little epiglottis. That's the elastic cartilage. All the other cartilages are hyaline cartilage. The epiglottis is elastic. And then you have the hyoid bone above it. So that's the epiglottis. And those would be your vocal cords there.
Oh, okay.
Do you guys have both cords, true and false?
Yes, they do, but they're not as developed as ours, but they do have 2 folds here. And I would show those on the model. All right, so larynx, thyroid cartilage, cricoid cartilage, vocal cords inside, epiglottis above it, and the hyoid bone protects it. Okay. All right, oral cavity, nasal cavity, rugae, teeth, tongue with papillae, diaphragm, lungs, liver, stomach, spleen, small intestines, large intestine, pancreas. Okay, this. I would not use this one for the pancreas. It's too dry. Okay, that should be it.
Thank you.
Thank you.